Officials are calling it a new twist in the opioid epidemic. Dealers are cutting their drugs with an animal tranquilizer, trying to lower their cost and make more cash.
And the result from that can be deadly. Our Josh Berry in studio with what we know so far about this dangerous development, Josh.
Yeah, Max and Janice, it's called Xylazine, also known as Tranq. It's a sedative that the USDA approved years ago for veterinary use. Currently, it's not a federally controlled substance. We Googled it. Anyone can buy a bottle online and for relatively cheap at that. Not only is that problematic, it can be deadly.
It's because of fentanyl that the United States is experiencing the highest number of drug poisonings ever recorded. Xylazine makes the crisis even worse.
Officials say drug dealers are mixing in Xylazine with other drugs like fentanyl or heroin as a cost-cutting measure. While it gives the user a similar opioid-like effect, officials say it's much more dangerous. Users are at a higher risk of an overdose. Beyond that, if someone injects this kind of mixture, they could develop severe wounds, even necrosis. What's more, naloxone, an overdose reversal medication, does not work on Xylazine since it is not an opioid. And this is happening almost everywhere. Labs in 48 states have detected Xylazine in drug samples.
Now, let me be clear, we are never going to prosecute our way out of the opioid epidemic. This crisis demands an all-hands-on-deck approach that includes medical professionals, mental health specialists, social service providers, and others. But disruption of the supply lines and accountability for those who manufacture and traffic in these poisons is an important part of the solution, especially with this newest twist brought by Xylazine.
And we need to note, while naloxone doesn't work on Xylazine, experts still recommend administering it if someone is suffering from an overdose. And separately, if you or someone you know is struggling with addiction, there is help available. The Substance Abuse and Mental Health Services Administration's hotline can refer you to treatment 24 hours a day, 7 days a week. That number is listed on your screen. Back to you.